And we scanned the patient then to look where the cancer might be. So it's a very good staging test for cancer patients, and many of our patients, not all of our patients, get PET scans on a regular basis. So this gentleman got a PET scan, and he had a solitary site of cancer in the adrenal gland. So everything in his body was fine. The cancer had spread through the bloodstream to the adrenal gland, which is a gland next to the kidney. Adrenal means on top of the renal, which is right on top of the kidney. It makes hormones for our body, and it gets a lot of blood flow. And so because it gets a lot of blood flow, a lot of cancer spread happens there. So in Israel, he started back on chemotherapy, a combination chemotherapy. Every month he had several cycles of chemo. And over these months, 3 bad things happened. I mean, one was the chemo, which unfortunately did not work. So that was really devastating to him and his family. Number 2, it was very toxic to him. So when 6 months ago he was here and in very good shape, he now is very weakened by the chemo.
Sure.
And then the worst part is the chemo actually didn't work, and the cancer spread in the adrenal, so it became more extensive.
Okay.
But it did not spread anywhere else in the body. So the interesting thing is he's got cancer. It spread to one site, and has been very debilitated by chemo. So the family contacted me about my thoughts, and he also saw doctors overseas. And because of their technology, they recommended radiation, but they recommended radiation that would hit the adrenal gland, which is where the cancer is, but it would also, because they couldn't focus the treatment, would also hit the kidney and destroy the kidney. So simultaneously with trying to hit the cancer, he would have one of his kidneys destroyed. And they were going to give the dose every day, Monday through Friday, for about 3 weeks, so a little dose every day. And we can be confident that the kidney will be lost. The success of that kind of approach is not particularly great. And I, without knowing that, was asked what I would do, and I recommended that he have stereotactic radiosurgery. Radiosurgery is non-invasive treatment. It allows us to focus the beams just on the cancer. So I usually tell people it's like a plum in a bread box. If the bread box is your body and the plum is your cancer, we can hit the plum without hurting the bread box. And we could hit the adrenal cancer or metastasis without hurting the kidney. So he has these 2 conflicting opinions. One is standard radiation close to home, and the other is stereotactic body radiosurgery, a non-invasive treatment that's 6,000 miles away. So that's what he's deliberating on right now, and because he's been so weakened by the chemo that he's leaning towards staying closer to home for
where he's comfortable.
Where he's comfortable, but most likely it's going to cause further deterioration in his function. So it's a big dilemma, and it's obviously sad for the patient and the family. It's sad for me as his doctor not to be able to offer him what I think is the best treatment.
Right.
So I'm just bringing this up to the listeners to talk about there are differences in treatment, and every doctor has their own experiences and ideas and approaches, and it can make a huge difference. One program we know is going to harm him and may not help him. The other one has a greater chance of helping him and doesn't have the same degree of toxicity or harm to him.
Now, doctor, do you think the decision would be easier if he were closer to radiosurgery?
Oh, sure.
Okay.
Sure. And, we have a lot of patients who come from very far away, hundreds of people who come from overseas, and it's, they're very motivated.
Right.
They've researched the differences. Sometimes it's hard to reinforce to the patient and family how different it can be. And he's already deteriorated on chemo, and now he's probably going to deteriorate more on standard radiation. So for me, it's very sad when you know there's technology that you feel is much, much better. We're going to take this break now from our sponsor, and then we're going to listen to some more cases and have some more news in the world of cancer. So, again, give us a call if you have questions, 1-800-848-9222. Thank you very much. Talk to you soon. For prostate cancer treatment, results and quality of life matter. Hi, I'm Dr. Gil Lederman from Radiosurgery, New York. Our enviable record includes treating thousands with prostate cancer. Critical to every man with prostate cancer and their loved ones is quality of life, urinary and sexual, and great treatment data while avoiding surgery. Treatment here is outpatient, with most insurances, Medicare, Medicaid accepted. First in America with radiosurgery for cancers from head to toe, we have the expertise to hit the cancer. Our fresh second opinion could change your life. For prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Radiosurgery, New York. Super conveniently located in Manhattan at 38th and Broadway, we hit the prostate cancer. Call 212-CHOICES, 212-CHOICES to hit the prostate cancer. For women with new or recurrent breast cancer, Radiosurgery New York specializes in breast cancer treatment. Hi, I'm Dr. Gil Lederman. We deliver quality treatment for women with breast cancer and are devoted to breast-conserving therapy whenever possible and desired. Treatment designed to keep one's breast and body intact. For women with metastatic breast cancer, Radiosurgery New York hits the cancer in most any site, lung, liver, brain, bone, lymph node, and beyond. We may offer a second chance even if chemo, radiation, or surgery didn't work. Radiosurgery treatment here is outpatient and non-invasive with most insurances, Medicare, Medicaid accepted. Our fresh second opinion could change your life. Innovative Radiosurgery New York. Cancer treatment with no cutting, no bleeding. Call us at 212-CHOICES, 212-CHOICES. We're super convenient at 38th and Broadway in Manhattan. Radiosurgery New York, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively.
Hi,
he was
good
the
morning.
first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hi, good morning. Hi, John. Welcome back.
Thanks, doctor.
So we talked earlier in the hour about cervix cancer, an interesting lung cancer case. There's new information for women with breast cancer. And obviously, more than 200,000 women in America have breast cancer, so it affects many of us. It's one of the most common cancers in women, one of the cancers feared, and really now better understood and better treated than ever before. And there's a new paper out which analyzed the use of tamoxifen. Tamoxifen is a hormonal medicine or manipulation medicine that takes away some of the estrogen in a woman's body. And tamoxifen has been used for decades. When I was in medical school 30 years ago, tamoxifen was used. When I was at Harvard, women prescribed tamoxifen would routinely have 5 years of tamoxifen treatment. So tamoxifen is an oral treatment, a pill a woman takes